not true, and this was not what I said. I remember last week, it was here on this platform when I came and gave an update. I said every state government has received its own share of the palliatives for onward distribution to the poor and vulnerable in their societies. And I still stand to be corrected on this. The palliatives we distributed are the palliatives we received from the Nigerian Customs Service, as well as the National Strategic Grains Reserves. This was what I said. There was nowhere where I said every Nigerian has received a palliative. I think this is very unrealistic, because it's just impossible to give every Nigerian palliative. Even if we are to be given the whole budget of this country, it will just not go round. It will be grossly inadequate. So there's no way we will give every Nigerian palliative. Palliatives are meant for a special group of people. That is the poor and the vulnerable, people living with disabilities, and other special groups, not every Nigerian. I don't think you and I need palliatives. So let me on this, let me close, by using a Hausa proverb, with the permission of my brother, the Honorable Minister of Education, of Environment, who is a guru in Hausa proverbs, by saying that idan mafaɗin magana wawa ne, majiyin magana ba wawa bane. And I think Nigerians are better informed. They cannot be deceived with this kind of fake news. So please note that at no time have I ever said every Nigerian has received a palliative. This is just in the imagination of rumor mongers. The ministry's mandate is very clear. It is to provide humanitarian assistance to the most vulnerable in our society, help with the mitigation of disasters, while establishing social safety nets that help us build resilience for the future. And as the pandemic continues, we remain resolute in the discharge of our responsibilities and mandate, and the ministry will not be deterred nor distracted by rumors and innuendos. Thank you very much for your attention.
Thank you very much, Honorable Minister of Humanitarian Affairs. We'll take the questions now, and the responses will come in after. Well, please let's be mindful of the fact that we have to conclude this before the news belt rolls in. So make your questions short and direct. Thank you.
Good evening, sir. My name is Friday Okerigbe. I'm a reporter with Channels TV. I'd like to direct my first question to the national coordinator of the PTF. It has to do with schools resuming for exit classes. Some states already, no, I think the national coordinator can respond to this. The Minister of Education has this on. It has to do with some states that are already directing that those who will be resuming to private schools, one of the conditions is that they must undergo the test for COVID-19, and they are paying a cost, 25,000 naira, for instance, in Ogun State. Is this approved by the PTF? That school children who are resuming, they should pay a cost for testing, like the one in Ogun State, 25,000 naira. The second question is related to that, and I would like the Minister of Education to respond to that. It has to do with the government schools. Information is already going around, because it was sent in by a parent, that parents should prepare to pay the third term school fees as schools reopen. Is it also approved by the Ministry of Education that all students in government colleges should pay school fees, third term school fees? Then the third question, I don't know, maybe the NCDC DG could respond to it, or the Minister of Health. What plans do we have, response plan this time, do we have in place to manage possible spike in the number of cases? I'm asking this question based on the fact that some countries that earlier resumed schools, we saw reports of spike. And so it's not impossible if we are going to see that in the next few days as schools are reopening for exit classes. So what management strategy do we have in place as we speak, so that if we experience that, it will not overburden the situation that we already have? And lastly, I would like to ask the NCDC DG also to respond to this. How many accredited private laboratories do we actually have now that can test for COVID-19? Thank you.
Good evening all. Rachel Abuja from the News Agency of Nigeria. My first question is to the WHO rep. Sir, in this area of controversy of COVID-19 and let's say politicalization of this virus, how can WHO verify the reliability of the different trials of vaccine ongoing at the moment? My next question is for the SGF. Sir, following on from what the DG and CDC has said on the progress of vaccine around the world, what is the government of Nigeria doing to ensure Nigerians will have access to one, if and when it's developed? Also, as we have spent time developing our labs capacity, as a result of this pandemic, what is being done to our research and development capacity to enable more internal industries play a part in developing our own research capabilities? Thank you, sir. And my last question is for the DG and CDC. Sir, Nigerians have observed decline in the numbers of daily positive cases in the past 2 days. Some Nigerians are already excited that we are beginning to flatten the curve. What's your opinion on this, please? And is it time for us to begin to talk about herd immunity? Also, how can we verify this and with science evidence, please, with scientific evidence? Many thanks.
Good evening, sirs. My name is Yemi Adebayo from AIT. My first question is to the Honorable Minister of State for Education. There are demands by private schools, private primary and secondary schools, for third-term school fees. I want to find out from you, does this have the go-ahead of the Federal Minister of Education to collect the fees even when the schools are not in section? Then my next question is to the National Coordinator. I want to find out from you, sir, how often do you meet with State Commissioner for Health? Perhaps the Honorable Minister of Health as well can also respond to this. I want to know how often you meet with the State Commissioner for Health, because a visit to some states in the past few weeks reveals that some residents in that state do not really believe that COVID-19 exists. Hardly would you see some people wear masks. I'm citing this example and I'm using Abia State as an example. in Abia State, I want to find out how often does the PTF meet with the leadership of this state to actually drive home this message you come on a daily basis to tell Nigerians of what is happening. Then the SGF, sir, Ogun State is still on lockdown on Saturdays and Sunday. I want to find out, is the protocol being used in Ogun State, is it different from what the PTF is using, or what's the coordination like between the PTF and some of these states who perhaps have separate policies and protocols? Thank you very much.
Good evening, sirs. My name is Juliana Taiwo Baloyen, Minister of Education. This is just a follow-up to the questions some of my colleagues have asked. Same Same on private schools. Some parents have reached out to ask government how they can address the problems they are facing. They are calling it a rip-off because some of them are being told to pay between 250,000 and 320 for exit students for only 1 month, instead of the 3.5 months they normally spend for third term. So they want to know how government can help them address that. Thank you.
The chairman, national coordinator, members of the PTF, my colleagues. My name is Amaka Ode. I report for Arise News. And my first question goes to the Minister of Health. So I had an opportunity over the weekend to really interact with some people who've actually, survived COVID-19. Let me use that word. And a lot of them have this belief that they cannot be reinfected. They believe they have some sort of antibodies that now make them not susceptible to COVID-19 again, because of course they've had it and they've survived. So I want to get your take on that. From all the evidence that you've gotten so far, someone who's actually survived COVID-19, can they be reinfected? That is the question. My next question goes to the DG of the NCDC. Now, sir, we are in the stage of community transmission in Nigeria, as we're seeing in other climes as well. Are we still carrying out contact tracing, looking at those who we've actually confirmed? If yes, how are we doing that? And how many contacts are we currently tracing? And still staying with you, DG, the last time you told us there was a website that was being developed to help our time as it concerns getting our results timely. It's still a major challenge. Even going to the hospitals, the clinicians will tell you their main issues, how long they have to hold the patient until their results are out. So where are we on that website? And finally, DG, still staying with you, a question just came in as I was sitting there. And he says, please direct this question to the DG of the NCDC. He says, Lagos State recently published update on COVID-19 on the 31st of July, stating that they have about 15,150 confirmed cases and total discharges 10,835. But the figures on the NCDC website is not reflecting this position. The question now, is the NCDC not updating or not collaborating with Lagos State, or why do we have this disparity? This might have its own impact as data is being collected for integrity's sake. Thank you.
Good evening, everyone. My name is Mitaire Ikbed. I report for the NTA. My question is for the DG of the NCDC. We are getting reports that some persons who reportedly died of COVID-19 are still being buried with big ceremonies and massive attendance of people with complete disregard for COVID-19 guidelines, especially in some parts of the southeast. I want to ask if the NCDC is still monitoring such trends and if you are doing anything about it. Maybe you need to rehash the protocols for burial of victims of COVID-19 for guidance of the populace. And I want to also ask, at the time, as a follow-up to what my colleagues asked earlier, at the time when testing is increasing, we're witnessing positive cases going down. So are we flattening the curve as a people, or we are in the process of doing so? Thank you.
Thank you. We've taken all the questions. We'll be receiving responses from the Honorable Minister of Health, the DG NCDC, the National Coordinator, the Honorable Minister of State Education, and the country rep for WHO before we invite the chairman to wrap it up. We'll begin with the Honorable Minister of Health, please.
Thank you, everybody. The question is, I think, from Friday about the strategy for managing spikes. It's a very good question because the reports we have from different countries, and as you know, we are all observing all countries. Everybody is observing the other and seeing what they do and what works and what didn't work. And it has been observed that there is actually spike when certain activities take place, like when you open schools or when you open transport system or you open the commerce, and some have been forced to shut down. But still, every country wants to reopen the economy and get things going. We talk about saving lives, but also saving livelihoods. People have to live. So that balance, that very delicate balance between saving lives and preserving livelihoods is what it's about with the PTF. And there is trying to get both at the same time. It's a very thin line. Now, the first thing to say about that is that the responsibility for managing spikes does not lie with government alone. It lies with everybody, with citizens, and with all the subnational governments. So you have a role to play in helping to enlighten the public, to allow the public to understand the needs that go along with reopening the economy. There are responsibilities and there are activities that will mitigate the harmful effects of reopening the economy. Specifically, we're looking at arrivals. There are arrivals that come from by air, usually, from other countries, and some of them by land too, which we manage carefully. We are preparing for those arrivals if and when commercial air transport opens. We want to be able to do screening by taking usual port health screening and taking samples of arrivals at the airport, so that we can tell immediately those who have arrived carry the virus or not. The other one is what I just announced in my speech earlier, that we are trying to expand sample collection to rural areas, because you might not find a spike if it's in the rural area that is not being very well monitored. And there's reason to believe now that if we focus too much in cities and urban areas, we might miss what's going on in the small towns and urban areas. So we want to start also looking at those areas. That's why I've mentioned oxygen kiosks in local government areas and sample collection. All that's part of the strategy to start getting ready for what spike you might have. And this spike might not necessarily be in the city, it might be outside. Then the important one which I started with, which is the risk communication, where all of you sitting here today are all involved in risk communication, in education in the public, in community engagement. We were talking today about also trickling down the responsibility to community leaders, to the gatekeepers of the communities, religious leaders, political leaders, and traditional leaders, to help to domesticate the idea of non-pharmaceutical interventions and measures for the people to be more compliant. So we believe that if we are diligent in keeping to these prescriptions, the impact of gradually reopening the economy will be well mitigated. And we may be able to get away with reopening the economy and not seeing a spike, or seeing only a minimal spike. But let me say again that it's a responsibility for everybody, for all of us here in this room today. And the other question is the question of possible reinfection. Well, that's something that's still a matter of conversation and guesswork. If you can be reinfected twice, if you can be infected again. I think the WHO country representative will say something about that too. It is too early, because we've had COVID for only about 5 or 6 months, for us to really know. From what we have read, I have read that only about 60% of people who got COVID actually developed enough antibodies, which means that, in fact, not everybody who had COVID-19 infection actually got enough antibodies, and that the antibodies actually began to wane and deteriorate, and after, I think, 3 months or something like that, only about 17% still had significant antibodies. But I think the WHO rep will fill up on that one, because this information is constantly changing as we learn more and more about it, as researchers begin to publish their works more and more. The story changes or shifts this way or that way. So the question of building antibodies is what actually protects you from reinfection. And if it is said that 60% build sufficient antibodies, well, nothing was said about the remaining 40%. So it's something that I believe science will eventually show, or those who have seen what the latest information is will also guide us. And if the antibody titer began to wane, to reduce after some months, then that is not very good news. But as I said, the information is constantly changing, getting more and more accurate as more research results begin to emerge. Thank you.
Thank you very much. I think the Honourable Minister has answered the question on spikes, but just to say that, as we respond to this outbreak and build up our health security architecture across the country, these cases will, even for the next few months, even when we get a vaccine, we have to always be prepared for spikes and respond to it. And that's why we're working with state public health teams to really raise their capabilities. Every state will now have, from the experience of this outbreak, a rapid response team. Hopefully we can have the funding to support health security in the long term, and that is really what will keep us safe. And all this has to happen every year before an outbreak, not during an outbreak. So really the investments that have to go into health security to keep this country safe at the federal and state level will be a political choice for every state and at the national level. So we are learning at the national level the investments that have to go into this, and these lessons will have to be learned at the state level in the short and in the long term. In terms of labs, private labs, we have 7 labs testing privately now in Lagos, 2 in Port Harcourt, and 2 are in the final stages of accreditation in Abuja. We're encouraging private sector labs to take on this responsibility. In Lagos, they have negotiated a rate to charge the public sector that want to go to test in a private lab. So they're negotiated rates. We believe that as more labs come in, we will drive down these prices of private sector testing, so that people that want to test because they want to start work or whatever other reason, they can go to the private labs and test, and we can keep the public sector labs for public sector testing. And so we're actually encouraging private sector labs. We've put up the guidelines, made the process very simple through an online process with the Medical Laboratory Science Council of Nigeria and the state governments, because state governments are responsible for accrediting labs altogether. We've made the process very simple, so we're actually encouraging labs to go on and take on this responsibility. There are a few other private sector labs that are testing on behalf of the public sector through arrangements with the states across the country. In Kaduna, we have DNA labs. In Imo State, Everbright. In Anambra, Kunalysis. Those have negotiated rates on which they are testing on behalf of the public sector as we build up the public sector labs. There was a question on the decline in the cases in the last few days. We all know we've had a long weekend. We've had an excellent Salah break. I hope you've all enjoyed your break. Many of us didn't have one, but it was still good to slow down a little bit. And that slowdown has also happened that many of those collecting samples across many states in Nigeria have also slowed down. Yesterday we had the lowest number of samples collected for many months. But we understand because we have been at this for 6 months. There's a bit of fatigue, but just like my brother Sandy just said, the virus is not tired. So we have to kind of find the energy to keep our spirits up, keep our determination up, and keep doing what we need to do until we get to the point of vaccines, like I said earlier. So please don't overinterpret the reduction in cases over the last few days. Our curve is not looking too bad, but remember it's a big country. Yeah? The curves are different in the different states and mean different things as well. But we're not in a worst case scenario by any means. Earlier in the year, some of the projections were really for an explosion of cases across the country. We haven't seen that happen, but we are not out of the woods yet. Our numbers are still what they are, like you know. So yes, our curve is not looking too bad, but it's not yet time to celebrate by any means. On contact tracing, right now we're following, I just looked at the data, about 11,000 contacts nationwide. You see, when we talk about community transmission, the intensity of transmission in somewhere like Lagos and FCT is different than in other states where you have a handful of cases every day. So where you have fewer cases, you can really pay a lot more attention to contact tracing because your cases are fewer. Where you are somewhere like Lagos, and you have, over the last few months, 100 to 150 new cases every single day, it becomes a little bit more difficult to do in-depth contact tracing for each of them. So really, this is about the capacity in every state vis-a-vis the number of cases that they have. So our guidance is never to stop contact tracing, but we understand that as cases increase in any state, they cannot follow every single case in the level of detail just because the number of people to do it becomes stretched. But once the curve starts coming down again, they're able to do it, and then they increase their work around it. So that's really the calibration that we propose for contact tracing work. The platform on electronic results has started already. So this is not a website where you can go and check. When you are tested, you will get a text message. So that is already happening in Abuja right now for everybody in FCT. Once their results are loaded onto the platform, they get a text message to check their results. They are given a code so that in case that text message gets lost, so they put in the code and then they get their result. If they want to print it out, they go onto the online website and print it out using the code that has been generated for them. It's a unique code just for that individual. So right now, if any of you has a reason to get tested, you will get your result in that, through that platform if you're tested within the Federal Capital Territory. If that works well, we will start offering it to other states to implement in their own states. The discrepancy in the number of discharges from Lagos is really one. Over the last few days, we had to come up with a criteria for discharging community cases. So cases that were found positive, that were not ill, and were never brought into care and managed in the community. So they weren't brought into hospital. So we defined a new discharge criteria for people like that. And Lagos had started implementing this, and they have just told us, so we will synchronize those numbers by the end of today. So this is really how do you respond to a backlog of cases who from the beginning of the outbreak were positive, remained in the community, and therefore we couldn't say we have discharged them in the normal sense of discharge from hospital because they were not brought into hospital in the first place. So we now came up with the strategy to do that, which they have now implemented, and we will now synchronize our data. So it's actually an example of collaboration and not conflict. And finally, Mitari, I think your question on burials. The guidelines of the Presidential Task Force are the same. Implementation is really a responsibility of the states to manage. Burials are not an easy thing to police using law enforcement. So we continue to encourage people across the country. We understand the sensitivity and importance of funerals. In almost every culture in Nigeria, it's important to, to give the final rites to our dead. But, the rest of us have to find a way of staying alive. And the only way we can stay alive, really, is to observe those. And funerals are actually a place where, because of the emotions, it's very easy to forget those principles that we offer. So the guidelines are the same. We're encouraging people to limit it to 20. And even within those 20, to observe all the physical distancing, face masks that are necessary. In many parts of the country, especially in the south and the southeast, there's been a backlog of funerals because of the restriction on travel. And in fact, across the country. So once the restrictions were lifted, you have this backlog of funerals that are now happening almost every weekend. And we understand why that is necessary. And ultimately, we need to say bye to our bereaved. But really, in doing this, we have to stay safe. And we have very clear guidelines on our website for what we call a safe and dignified burial. We always add the term dignified because it's important that even in these difficult circumstances, we recognize the importance of at least managing as much as we can to carry out a dignified burial. Thank you.
We'll take the national coordinator.
I think I had only two questions. The first one had to do with the issue of paying costs by students for testing for COVID. So our protocol is very clear when it comes to the indications for testing. And it's also important to realize that when you do a COVID test, if you get a negative result, it's only valid for that period of time, for that point in time when you had the swab taken. So the next day you could have a positive result, especially if you are in an incubation period. Therefore, the validity of a negative test is quite limited. It's far more important to monitor for symptoms, to check for temperature, to make sure students that have symptoms of a cough or any other respiratory symptom are told to stay back at home and seek medical attention. It would be far more useful than doing a COVID test before they resume. And it would be safer as well. So in other words, monitor the students rather than testing them at a particular point in time. Secondly, how frequently do we meet with the commissioners of health? Well, actually, we have pretty strong engagement with the state governments. In fact, we have a representative of the Nigeria Governors Forum embedded within the PTF pillar structure. We have met virtually with commissioners of health on various occasions. More recently, we had a meeting with selected commissioners of health from the states that we call the hotspot states, 4 of them that have a relatively high burden. I know the Honorable Minister of Health meets frequently with the state commissioners of health. In fact, with Lagos, I speak to the Lagos Commissioner of Health at least once a week. We have fortnightly meetings with the subcommittee of the Nigeria Governors Forum. So there's clearly a lot of engagement and interaction at the state level. I think what is happening when it comes to issues of disbelief about COVID or a reluctance to follow the non-pharmaceutical interventions we recommend is more to do with the messaging and also more to do with the nature of the illness itself. As I said earlier on, unlike other pandemics with COVID infection, the majority of people will continue to be relatively well. So pushing out that message that it's not really the young ones that will be an issue, it's really the elderly, those with comorbidities. And when we protect ourselves, we are also protecting our loved ones that could be put in a very vulnerable situation and could potentially die from this infection. But as far as the PTF is concerned, we continue to engage very closely with the state governments, and we have a very healthy relationship.
I'll take the country rep for WHO before we take the Honorable Minister of State Education.
Thank you for the question. The first question was about the means WHO has to validate the result of clinical trial on vaccines. What I can say about that is, if you remember when the WHO declared the COVID-19 as a public health emergency of international concern, it launched a global response plan, which was framed around 3 objectives. The first one was to coordinate international response. The second one was to develop guidelines for countries to develop their own preparedness and response plan. And the third one was about streamlining research and development. It's in that context that some initiatives were launched, including the initiative to start research into vaccines. Ever since, there was a group of researchers that were invited in Geneva to start reflecting on possible ways, possible avenue with respect to potential candidate vaccines. And several groups registered for clinical trials. So it's in that context that many of these clinical trials are ongoing. Now, when the result will come, WHO, as I said it last meeting we had here, WHO has a strategic advisory group of experts on vaccine and immunization. It's that group that reviews the evidence. They look at the safety of the candidate vaccines. They look at the efficacy. They look at the effectiveness and many other parameters. They judge the weight of evidence to know whether it's credible or not. It's based on strict criteria that group can judge that this vaccine is effective, can be rolled out or not. And usually the criteria that we use is to make sure that based on the evidence presented, that vaccine can protect at least 60% of the people that were vaccinated, usually compared to a placebo or another group of interventions. So that's how WHO judges, and it's a very strict, rigorous procedure before WHO could recommend a vaccine for wide-scale use. The second component is just a complement to what Honorable Minister of Health was talking about. What happened when somebody has been infected, survived COVID, in terms of whether the person could be reinfected or get sick again. As the minister said, this is a new disease. We are learning every day. The preliminary evidence suggests that normally if you get infected, you develop some kind of protection or immunity. But the first preliminary evidence suggests that that immunity does not last long. It's just about 3 months or so, and then it wanes. But then we have 2 types of mechanism of defense. So we have that defense that depend on some chemicals that individual produces when he gets reinfected, the antibodies. Those ones do not last longer. But we also have the memory, the type of defense we use when the virus gets to the cells and those cells get destroyed. That type of memory, some studies suggest that it may be there even though the mechanism used by the chemicals might wane within 3 months. But as the minister said, we are still learning, so we don't have a definitive answer. And surely, by some time, some over the next weeks or months or so, we might get answers through evidence that's coming in. Every day, there are hundreds of publications on what is being discovered with this coronavirus. Thank you.
Good evening, everybody. Now to say schools essentially open at the moment for exit classes. They've already commenced, some of them today. I monitored some of the developments around Lagos State, who's been open. Some other states will open as the week proceeds. The federal government colleges will begin in the morning from tomorrow to take into them. But the questions that you've asked revolve around what this plan is, whether it is adequate or is proper for people to charge fees for a third term. Now, we did communicate last week before we went on the break that really, once these WAEC exams start on the 17th of August, it will run through to the middle of September. We will immediately thereafter commence NABTEB. NABTEB exams are national business and technical examinations, which also qualify you to go to universities with. It's not just WAEC. And that exam will run into October. About a week to its end, we will begin NACO exams on the, that will be the 10th of October, and that will run through to November. So for all of this period, we expect that children are working, they're examining, and they're learning. We don't just want them to be in the schools and be playing. This is serious stuff. This is exit class. This is what says a lot about the 6 years you've spent in that secondary school. So we believe that even right now we are leaving the registrations for NABTEB and NACO continuously running, even while we are about to begin WAEC, because we know that the WAEC results are not expected till way after November. So you probably may have to take these 3 exams. But more importantly is all WAEC and all exams are a test of outcomes. We want to know what it is you've learned over the years. So we want our teachers to continuously engage them. And that is why in my Zoom meeting today with all the commissioners of education around Nigeria, I met with them at 11 o'clock. Fortunately for us, for a place like Lagos that was reopening today, for Madam Falasha, the Commissioner for Education there, was going around the schools to see and put them on Zoom to show us what exactly how we've distanced the classes. Many of them will not be more than 20 in a class. It's for a huge school that can take 1,000 and you bring in 200 people, they just be swimming around the school. That's exactly what we wanted to achieve. We want to achieve those kind of social distance. And we spoke with the principal of QC in Lagos, and she, on behalf of the other principals, explained how they've met with them. From tomorrow as well, myself, the officials of the Ministry of Education will be touring the federal government colleges around the country, because we're going to be using all the directors, because when we finish the monitoring, we will evaluate the state of preparedness and what gaps that need to, you may notice from what the NCs pointed out, we didn't demand testing because we are aware that the results show that your positive test is only as good as tomorrow. So the important thing is with the regime that we've imposed in the schools: hand washing, early detection, mask wearing, making sure everybody's clean, making sure everywhere is distanced, all of the protocols that have been asked to establish. We've established all of them, and we're going to be evaluating them rapidly and be able to be present and be able to react as soon as we can, and making sure that everybody is on their toes. That's why we're almost monitoring them on a rapid basis. Now, you're also going to be asked, I would like to answer what private institutions may want to charge. Really, for government institutions, we can't tell you that we charge school fees. Most of our schools are free. Public schools are free. So I don't know, it varies from state to state. But when you go into a contractual relationship with a school owner is a passionate person, but is also a business person. They're not running a charity organization. They may be charitable in their approach, but it's not a charity. So it is important that you appreciate that a private school is entitled to charge fees for the work they do. The person that runs the school, or the proprietor or proprietress, may in actual fact be a very passionate person about education. But I'm sure they are not going to make provisions with their broad. They are going to be charging you for it. Now, for the places where we control, which are public, essentially there may be some sort of assistance that comes from the states that own them, because the majority of these schools that are public are owned by states. And those states are making a lot of effort. On Saturday, I was on a Zoom meeting with Anambra State Education Authority, and they have gone to all kinds of lengths to make sure that they are providing for their people. Even Yobe was telling us this morning that they are ready. They've distributed washing hand pads. People have gone, state governors have done a lot. Professor Zulum, who is an education and a governor in the state, has already proactively procured all of the things that were needed. So a lot of states have made that effort, and we encourage them to continue to engage. However, it will be it actually is not in our place to demand that kind of compliance with private institutions, because they provide for the things there. If there are any ways we can assist them, we will. If there are compassionate manner with which you can approach them to become a little bit more charitable with the engagements that they may offer parents, then that is also acceptable. However, that is not within the purview of the local of this PTF. Thank you very much.
Thank you. I will now invite the chairman of the PTF to the podium.
I'm not sure there's anything to answer. All the questions have been taken, but just for the purposes of emphasis, I think that there was a question that dealt with the issue of research. Rachel, you are the one that asked about that question. About research, the capacity and all that kind of thing. I think we've done tremendously well in that area. About 2 weeks ago, I did inform you that I was at the Central Bank, where I inaugurated, on behalf of government, a body of experts drawn from all over the country, people that have been involved in research work, and also all in an attempt to build capacity and build institutions, pushing the agenda of developing a homegrown cure or vaccine for COVID-19. I believe in the process. A lot of money is being considered, but I'm not very sure. Something around the margin of about 26 billion is what the central bank is taking out for the purposes of pushing the agenda. I believe that post-COVID-19, our infrastructure for research would have been solidly established. And even before this particular committee that is chaired, a body of experts that is chaired by the DG of NAFDAC was inaugurated, so much of interventions were put in place by the central bank. 100 billion to the health infrastructure facility that was made available for pharmaceutical companies and hospitals and big health institutions to draw from. One, to address the very negative impact of COVID, but two, to help them also re-strategize and build capacity for the production of medicaments and all the things that are required in our national response. So I think we're doing pretty well. there was a question that had to deal with vaccines and how, I think it was, you were the same person that asked about how to deal, or was it the IT chap that asked about that, how to deal with the issue of vaccines. How do we ensure that Nigeria as a nation is not in any way shortchanging the processes of acquisition of the vaccine? If you follow in the international media, it's a highly complex and competitive thing. China is pushing its own agenda for the development of the vaccine. Israel is doing the same thing. France and the European Union countries are doing the same thing. The United Kingdom is also pushing its agenda for the development of vaccine. Russia has put it out there in the media space. Probably before the end of this year, they will begin to administer vaccines to their people. So much of financial commitments are going into that, but I think the country rep of WHO had alluded to that, that we are signing on to different arrangements as a nation so that we do not lose out when vaccine is eventually developed, is tested, and is confirmed to be ready for use on human beings. They are in different stages of trials, but I believe that with the current involvement in Nigeria in different platforms, we will definitely position ourselves in such a situation that when vaccines are made available, there is an equitable processes of its distribution so that the big boys do not corner everything. The world population is about 7 billion or thereabout. To produce vials of vaccines to meet the need of 7 billion people, it's a lot of work and it's a lot of resources that will be committed. But one thing that we are trying to do is to make sure that there will be some form of equitable distribution of those vaccines so that even developing countries and countries that do not have the financial capacity to acquire these vaccines would be programmed in such a way that in the processes of the distribution, they also will be able to access the vaccines. And knowing fully well, even with the eradication of polio and other health challenges that we've had in this country, not everybody gets the vaccine in one day. It's a program application of the vaccine that has continued over the years. And I think with COVID-19, it will be the same thing. Not everybody would have access to the vaccine at the same time. This will be left for our health institutions to determine who are the ones that are the most in need of the vaccine. So there will be a systematic processes of its distribution. There was a question from you too about the issues of lockdown with Ogun State. When we started as a presidential task force and we designed the national response, we were quite oblivious of we were not oblivious of
Nigerian, a broadcast network committed to serving you the very best in online and offline television programming. Situated in the serene environment of Guzape, Abuja FCT, TVN, as it is fondly called, caters to a wide variety of audience via carefully orchestrated mind-blowing programs in the areas of fashion, business, politics, entertainment, religion, movies, food and health, culture and lifestyle, events around the globe, sports and foreign news. Whatever your inclination, we've got you completely covered with programs like Issues of the Moment, The Patriot, Daybreak Nigeria, Mata Africa, TVN Business Time, Healthy Living, From the Cradle, Stay Inspired, Entertainment Gist, Movie Hour, Hits Paradise, among others. All designed to keep you thoroughly informed, entertained, at the edge of your seats and yearning for more. A tour around our domain will reveal a highly dedicated staff force and a state-of-the-art facility and equipment for high-definition quality broadcast, making our station your #1 choice in advertising your business and propagating your ideas. We are currently on Nigecomsat doing our test transmission for takeoff in the nearest future. Television Nigerian is located in Nigeria at Television Nigerian House, Guzape Hilltop Mansion, beside Guzape White House, Guzape Abuja FCT, and in the United Kingdom at 45 Ancient House, 48 Aerodrome Road, Beaufort Park, Colindale, London. For inquiries, Television Nigerian is Television Nigerian, a broadcast network committed to serving you the very best in online and offline television programming. Situated in the serene environment of Guzape, Abuja FCT, TVN, as it is fondly called, caters to a wide variety of audience via carefully orchestrated mind-blowing programs in the areas of fashion, business, politics, entertainment, religion, movies, food and health, culture and lifestyle, events around the globe, sports and foreign news. Whatever your inclination, we've got you completely covered with programs like Issues of the Moment, The Patriot, Daybreak Nigeria, Matter Africa, TVN Business Time, Healthy Living, From the Cradle, Stay Inspired, Entertainment Gist, Movie Hour, Hits Paradise, among others. All designed to keep you thoroughly informed, entertained, at the edge of your seats and yearning for more. A tour around our domain will reveal a highly dedicated staff force and a state-of-the-art facility and equipment for high-definition quality broadcast, making our station your #1 choice in advertising your business and propagating your ideas. We are currently on Nigecomsat doing our test transmission for takeoff in the nearest future. Television Nigerian is located in Nigeria at Television Nigerian House, Guzape Hilltop Mansion, beside Guzape White House, Guzape Abuja FCT, and in the United Kingdom at 45 Ancient House, 48 Aerodrome Road, Beaufort Park, Colindale, London. For inquiries,
there are a lot of false information about the coronavirus. These are the facts. People of all ages can be affected by the coronavirus. However, older people and people with pre-existing medical conditions such as asthma, diabetes, heart diseases are more vulnerable to the disease. It is not for old people alone. Gargling salt and warm water or chewing garlic and ginger cannot prevent the virus. Drinking alcohol, hot lemon, palm oil or chloroquine will not kill the virus. The virus cannot be transmitted through mosquito bites. Antibiotics do not work against the viruses. Antibiotics work only against bacteria. Boiling pineapple peels, lime and ginger does not kill the virus. Putting raw onions in rooms will not ward off the virus. Using or spraying Dettol, special oils and water all over your body cannot kill the virus. There is no scientific evidence that cooking, drinking or eating any of
The headlines: Microsoft to continue TikTok acquisition talks after meeting Trump. Shoprite initiates process to exit Nigeria. And on sports, Will Lewis Hamilton wins record 7th British Grand Prix. This is World News at this time. You can follow this broadcast by live streaming at YouTube and Facebook at Television Nigerian. I am Susan Achin. Microsoft announced Sunday it would continue talks to acquire the U.S. operations of popular video-sharing app TikTok after meeting with President Donald Trump, who seemingly backed off his earlier threats to ban the Chinese-owned platform. Following a conversation between Microsoft CEO Satya Nadella and President Donald J. Trump, Microsoft is prepared to continue discussions to explore a purchase of TikTok in the United States, the company said in a statement, acknowledging the importance of addressing the president's concerns over national security. Microsoft added that it would continue negotiations with ByteDance, TikTok's Chinese parent company, with the intention of completing these discussions no later than September 15. The statement came after Trump on Friday said he would ban the app, which is especially popular with young audiences who create and watch its short-form videos and has an estimated 1 billion users worldwide. The death toll from a toxic bootleg alcohol scandal in the North Indian state of Punjab rose to 98 Sunday, officials and reports said. Police have arrested 25 people so far over the worsening tragedy, which started coming to light late last week, the Press Trust of India news agency said. Hundreds of people die every year in India from illegal alcohol made in backstreets distilleries, which sells for as little as 10 rupees, that is 13 US cents a litre, affordable for even the poorest. The death toll from the illicit booze has risen to 75 in Punjab's Taran district after further investigation, the local administration's Deputy Commissioner Kulwant Singh said. Now, 3 ministers in Gambia's government have tested positive for the coronavirus, officials said, days after the West African nation's president went into self-isolation. President Adama Barrow said last week he would self-isolate for 2 weeks after Vice President Isato Toure tested positive. Finance Minister Nambure Njie, Petroleum and Energy Minister Fafa Sanyang, and Agriculture Minister Ami Fabure have tested positive for the virus, the presidency said in a tweet on Sunday. Health authorities in the former British colony of some 2 million people have recorded 498 coronavirus cases to date, with 9 fatalities since its first case was reported in March. Now, one of Africa's largest supermarket chains, ShopRite, has begun a formal process to exit Nigeria. In a trading update published on Monday, the South African-based company said the decision was made after approaches from various potential investors and in line with our re-evaluation of the group's operating model in Nigeria. The company said when it reports its results from the year, its business in Nigeria may be classified as a discontinued operation. The company's Nigerian business posted a minus 6.3 decline in sales for the year ending June 2020, according to its Monday update. The company entered the Nigerian market in 2005, and its exit continues a trend of South African retail business struggling in Africa's most populated nation. Mr. Price, another South African retailer, announced plans to close its Nigerian business in June. And now moving on to the world of sports, World Championship leader Lewis Hamilton survived a tense last lap drama with a deflated and shredded tyre to claim a record 7th victory in Sunday's British Grand Prix. The 6-time world champion led from lights to flag and through 2 safety car interventions before he suffered a front left tyre failure on his final lap, leaving him to nurse his Mercedes home with second place Max Verstappen in hot pursuit in his Red Bull. The Dutchman had inherited second when Hamilton's Mercedes teammate Valtteri Bottas, running comfortably in second for most of the contest, was hit by the same problem, his front left delaminating and deflating on his penultimate lap. That was World News on Television Nigerian. I am Susan Achin. Thanks for watching and stay safe.